All right, everybody, welcome. Thank you for joining us. Come on in. We have a lot to talk about today, for sure. I am talking to the fabulous Deb Houry, who served our country for a decade at the CDC. She was its chief medical officer. Her colleagues described her as brilliant, hardworking, and effective. Her work earned her the AMA's Award for Outstanding Government Service. Her talent, her determination to serve the public, it served America well for years. But those same qualities drove her to resign the post in August so that she could warn Congress and all of us about the disastrous leadership of Bobby Kennedy and the increased risks now confronting every American. Deb, thank you so much for your courage, for your outspokenness, and for your willingness to join all of us here today.
Thanks for having me.
Deb, the question I really want to ask you, because you told Congress when we still had a Congress that met, that Republicans and Democratic administrations alike that you served under had different priorities, but they always put the facts and the public health first. So before we get into the ominous until now part, I think it's really important for people to understand the fabulous work that the CDC did over the years. I don't think when people hear, oh, we're getting rid of another government agency, they have no clue what a fabulous government agency is under attack.
So, what I would say about CDC is I was actually an ER doc, in a county hospital. When I had the opportunity to join CDC, I jumped at it because I saw the opportunity to really take care of the nation and communities as my patients. And that's what CDC does. It's boots on the ground in all the communities, protecting us, the American public, and around the world from different health threats, whether it's making sure that we're getting screened for high blood pressure or cancer, to responding to overdose or suicide clusters in communities, to working with countries, to prevent Ebola from coming to our shores. That is what I think is so special about CDC. And I had worked at CDC for over 10 years through 4 administrations, really in a bipartisan fashion, because it comes down to taking care of, I put my ER hat on, the patient, which means the population. And when you talk with Congress, if you're focusing on health outcomes, usually you can find that common ground. This past year, I was the transition lead for CDC, which meant that every 4 years there's a presidential election and we bring a new administration in. And a lot of our political advisors will change. So I was prepared. I had read RFK Jr.'s books, as well as many of the papers of the incoming administration, to really have the agency prepared to see where we could support new priorities. Unfortunately, though, that's where things really started to come apart. And that is just when we saw that data and science were not driving decisions. It was more ideology. So for the first few months, you always get used to new bosses and priorities. And so, tried to learn what was helpful for them. I think for me, what was kind of an alarm was during the measles outbreak. We weren't hearing from the secretary, and we'd offered to brief him. And we did not brief him. We pointed out the increase in cases, provided talking points on vaccines, and that's where he had promoted misinformation, saying that the vaccines had fetal parts or were killing people. And that wasn't helpful to do in the middle of an outbreak. We needed to focus on prevention. Certainly, there were things like a role for vitamin A for treatment, but not for prevention. And then he had highlighted healers in Texas that were supporting unproven treatments like budesonide and clarithromycin, which I were worried, could actually cause harm if people were using things that weren't indicated for measles. So for me, that's when things started to come apart.
I think American ignorance about what you've done could just remind me, the flu vaccine every year that we get it. People think, oh, I got the flu vaccine, but it's really not the same vaccine every year. There's a ton of work that goes into making it effective every year. And the CDC had people all over the world tracking viruses and how they moved. Can you talk a little bit about just about the complexity of keeping Americans healthy?
Yeah, so, we're always monitoring different strains, so whether it's that new COVID variant or what's going into the flu vaccine, and our labs around the world, are testing for these different health threats. And even in airports in the US, we're looking for things like that. But that requires resources and staff. And currently, with many of the staff firings as well as proposed budget cuts, that's going to leave America less safe. And I'm concerned too with the withdrawal from the World Health Organization that we're losing a lot of those partnerships with countries. And so we won't have that visibility, which again is about protecting ourselves from threats abroad and in the US.
You guys also protected us from biohazards, I think, as well. I mean, it's the importance of the CDC is so hard for Americans to see because you did your job.
Yes, when we do our job, people don't see it because we prevented something from happening. Or, the beauty of like our non-communicable disease work is we've prevented those overdoses. People with high blood pressure, are now controlled and not going on to have heart disease. People are screened early for cancer. And that's what's so important, is ensuring people can live the healthiest lives possible.
And there was a scare a few years back with something called a Zika virus.
Yes.
Talk a little bit about that and the work that you did. It was terrifying, particularly for pregnant women. They were scared to death, and with good reason.
Well, and I think that the Zika virus just shows why you need all of CDC together. And there's a new virus or an emerging virus called Oropouche, which is very similar to Zika. And with Zika, what we found was it was sexually transmitted, but it came from mosquitoes. So you would never think that something that could bite you could then transmit sexually as well. We learned that, and then we needed an environmental health specialist to talk about how do you control the mosquitoes. Then we needed a reproductive health specialist to talk about the impact it had on pregnant moms and the babies, because we did see some birth defects. And then you needed certainly the entomologists and like all the infectious disease experts. So that's where you really needed an all of an agency approach. And one of the things I raised for the incoming administration is in South America, there's a disease called Oropouche, transmitted through midges and mosquitoes. And we're now seeing it in Cuba and Dominican Republic and other areas. My concern, we've had travel associated cases in the US, not domestically acquired yet. But my concern is if we're not prepared for it and not monitoring it, we're going to have another Zika on our hands.
And that led to really frightening birth defects that really terrified people. So we're less safe. I get it. Less prepared. What is, in your sense, what is the administration thinking? If they're not thinking this is about keeping us safe, do they just don't believe that we're at risk?
I really can't speak to what the administration is thinking. And honestly, when I saw the recent reductions in force and firings this past 2 weeks, it left me very confused. The secretary has talked about the need for, conflicts of interest and vetting them and decreasing bias, but he fired the conflicts of interest office at CDC. Mm-hmm. Similarly, the Institutional Review Board office that protects human subjects in research was fired. And many of these things are needed for that vaccine committee that he has made a priority. So this really leaves CDC hampered, unable to do a lot of its basic job, including when you don't have an HR department at all.
When you reflect back on the sort of attack on CDC, it began during COVID. What was CDC doing during COVID that drew the wrath? Maybe nothing, or maybe it was just an easy target because the country was hurting so much. But how do you think about that? You're out there every day at risk, trying to save the country during a terrible pandemic, and suddenly the guns are turned on you. What was that like?
Yeah, I think a lot of it is, this was really an unprecedented pandemic where CDC as well as other agencies were still learning, what the virus was, how you protect, yourself from it, the vaccine initially, and the science was evolving. And so, some guidance that was issued early needed to change when there was more information. So I think that really led to distrust of the CDC, when our director was saying one thing and then it would change a few months later. And I think that's just where CDC learned to be much more upfront about what we know today, what we don't know, what could change. And that's really the principles of crisis communication. And there were some missteps. There were some lab issues. But what I can tell you is, I was brought up to the office of the director midway through COVID to look at what were the lessons learned and how could CDC improve going forward. Mm-hmm. The CDC really looked at lab quality. They have new measures in place and working much more with private sector. They also looked at data timeliness. they were faxed reports, and we didn't have access to state health department data for some of these things. That was all put in place during COVID so that going forward,
We'd
it wouldn't happen
safer.
again.
Yeah.
But my concern is we're backsliding now as a nation with a lot of those improvements.
So, for example, I guess we're now in like the second or third set of measles running around the country. And the CDC it used to work with states when there was an outbreak. And like that can't be happening now in the same way.
Well, it can't be happening in the same way because there's less boots on the ground. CDC's lost about 30% of its workforce. In addition, as we lose different experts, like from occupational health, where they do a lot of the ventilation safety, that makes it difficult to assess, different environments. But CDC is still continuing to work with states, certainly more difficult during a furlough right now. But in general, they have been working with states. And this year they did deploy to Texas for the measles outbreak. I don't know if they've deployed to South Carolina or Utah. But I do want to point out, like, CDC doesn't just deploy to states. States have to ask. So you have to have that partnership.
Yep. There's a big public education aspect to public health. And the CDC's website has long been a thing that, well, not just Americans, people from all over the world have looked to for guidance on what's the best science on how to take care of ourselves and how to respond to all kinds of things related to public health. That website looks to me like it's now becoming just another campaign, a political campaign. What's lost?
Yeah, I was disappointed. I saw that changed shortly after I left. And in my mind, CDC should be just focused on data and science and really not have any of political priorities or agenda items on there, because you want people to understand how to protect yourself. And you want everybody to feel comfortable looking at the website, see themselves in the guidance. And many of the things that were put on the website don't even have anything to do with CDC. And so that just makes people automatically start to step back and not trust CDC. There's amazing staff still at CDC, but I almost call it like a hostile takeover right now, because the front office really has allowed some of these changes.
And I don't have a good enough imagination to understand the political benefit to anybody of making the CDC partisan, but for it's a few patronage jobs, I guess, if that's how you think about it. But it seems in a country the size of the United States, that's silly. What can they gain by this?
Yeah, and in my mind, it's really not political or partisan, it's ideology. Because, like in the ER, to me, I never knew who was a Republican or a Democrat. You just take care of the patient. Same thing with communities for public health. You take care of everybody. And so it should be about, how do you protect yourself from diseases? How do you respond to, a train derailment? We all want the same thing. And so for me, this is really about the secretary's ideology that we're seeing reflected. And
that ideology, it's weird because I'm used to ideology being a political ideology. This sort of isn't. It's an ideology about vaccines, which is.
And President Trump, I really applaud him and thank him for getting his COVID and flu vaccine. And I think that's important for the nation to see and recognize that he understands the importance of vaccines, and he launched Operation Warp Speed. So that's why I think it's more of an ideology versus politics. Yeah, I'm used to ideologies being about politics, and this ideology isn't really. It's about I don't know what it's about. It's about, I believe that the species is better if we just all get sick and the healthy ones live. Yeah, and it's tricky because I did read, several of the secretary's books. And, I'm a scientist, so I like to see, what I can learn. And as I was reading, some of his, pieces, I would kind of question and go, gosh, I wasn't aware of this. Then I would go check the reference and saw it was from a retracted study. And to me, that was really disappointing. Yeah, so on top of it being an ideology, what you're saying is it's an ill-informed one based on junk science. Yes. Yeah. And so junk science now is the official science of the United States government as far as our public health agencies go. And, I think it's okay to ask questions. Science does evolve and change. So it's okay to ask the questions and look. but we have to agree on what is valid science and data. And, if you've got retracted studies or things that appear in Snopes, those are not the things I'd make policy decisions off of.
Yeah, I mean, for those of you who are listening, scientists are, in my experience, are the last persons on the planet who claim that they actually know everything.
Yes.
Right? Every single thing they discover, they say this is provisional until we have better data and a better way of understanding it. Yeah. So it's usually ideologues who claim they actually know what's going on, and that's why it's so dangerous.
Yeah, and that's what I have found to be difficult because I'm willing to have a discussion with anyone, but we all have to agree, where we can find that common ground, and some of that still has to be based on, what is true science and data, and like you can't just say the Earth is flat. We've got good data that shows that it's not. And so that's where there's that push pull.
And science itself evolves.
Yes.
In middle school, people are taught the scientific method, but the method itself evolves. It gets more complex and more fine-tuned, really, to the problems it's trying to understand, not solve, but understand. And
Yeah, no, like with the vaccine committee, like what we saw was, they ranked data or in science, like randomized controlled trials with was at the top, personal anecdotes at the bottom. And that's how you need to evaluate data in science is like the best gold standard science at the top. The issue we had this most recent vaccine committee meeting that CDC put on was the committee members called themselves rookies, and they were bringing personal anecdotes, didn't understand process and procedure, and weren't valuing the most gold standard science. And that's when it's difficult to have those conversations.
I think what I saw was not just not valuating gold standard science, but not recognizing it,
Yes.
not recognizing the different sets of data based on the way they were collected and the way people understand them aren't all equally valuable either.
Agree. And even bringing in, I believe it was during the hepatitis B discussion, bringing in discussion on a version of that vaccine that's not even in the US. So it really was not relevant to the discussion and just confused things.
Yeah. Well, so how do you see a way forward that protects America's health? Are the refugees from this government finding ways to organize outside of the government to help protect Americans?
So I think that's starting to happen, and that's both good and bad, right? Because I know many states are now looking at how they can develop their own health policies, collect their own data, and I understand that, but I don't want to see differences in which state you live in as to your access to public health and healthcare and data. I'm working with several of these states now to really help advise on how they can have good public health and healthcare in their communities.
Mm-hmm.
I do think, though, I don't want to lose sight of what could be done at the federal government. And I think if Congress had oversight, and allowed CDC to have the authority and to have a permanent scientific leader and to look at things like the advisory committees, make sure they're actually following all the federal advisory committee processes, had rigorous discussions, brought in the right experts, and none of that is happening.
I so appreciate that, but it is a pipe dream with this current Congress. I mean, this current Congress isn't even in session, right? They've gone into hiding. They're like in the witness protection program somewhere because they don't want to have to say what happened to the East Wing of the White House is like ridiculous and terrible. And we don't want a palace there. But so they're hiding. They're not going to do any oversight.
Yeah, we do need Congress, certainly, I'd say, to pass the budget.
Would be nice, but they don't, it's just not, that's not going to happen with this. I mean, you're not a political actor. I am. And I'm just like, they won't do it. This is not, we aren't going to get the oversight that every administration, no matter what party, needs. We're not going to get the investigations, good and ill, that our government needs to do well with this Congress. It's just not possible. We need a political change in order to get the scientific one you're talking about.
Yeah, and I think until we have that, you will see I saw many of the big cities now have also banded together and put out a note that they're going to issue their own vaccine recommendations. I tell people, talk to your doctor right now for the best medical advice. And, I would always say, talk to your doctor, but now I think there's less alternative sources like the CDC for some recommendations for
Right.
people to trust. And that's
But sometimes even, sometimes vaccines that you used to be able to get now require a prescription in some states. It's a complicated mess. And these viruses these vaccines don't just protect the person who gets the vaccine. They stop the virus from having a reservoir to mutate and change and get and go after the people who did get vaccines. You can't protect yourself alone. That's why it's public health.
And that's why with things like measles, vaccinations are particularly important because it is so contagious. And that we see if the vaccination rates drop below 95%, that then you start to see, people become infected. And many of these places, actually all the ones that are having the outbreaks, have vaccination rates lower than 95%, some, in the 80s. And that's where we're seeing that the virus really sets up, camp and can then, find, different hosts.
And Americans are blasé about measles. They're like, well, I had it as a kid. It can't be that serious. Even if it's not killing people, it's enormously expensive for our society.
It's enormously expensive, and it did kill people. It killed 2 children, 1 adult this year, and then we saw in California there was somebody that died from measles, delayed encephalitis. And so what people are forgetting is that even if you recover from measles, you can have longer term consequences from it. And many people were hospitalized, with pneumonia and other issues. So it's not a harmless childhood disease. And we're lucky that we have vaccines in the United States for many of these childhood preventable diseases, and I would just say as a mom and a doc, I've been always encouraged people, to take care of their families and their loved ones.
So what do you think's going on in Florida? What's going to be the impact of a state saying we're no longer going to say you have to have vaccines to come to school? I think they put every child in jeopardy.
I think they're also putting tourism in jeopardy. I think, you think about Disney and, being right there in Florida, as a parent, if I had a young child or somebody who's immunocompromised, I would be worried if I knew that the vaccine rates were low around there.
Sure. And then I suppose they will have outbreaks of one thing or another, and that will also be a problem for them. Wow, I didn't even think about that. Well, this is hopeful, right? Now, so right now we are organizing, as you said, it's not preferable, it's not smart, but we're organizing outside of government.
Yes. Or outside of federal government.
Outside of federal government, yeah. And our organizations like the AMA and others stepping up and trying to do what they can in this crisis?
So I would say, the American Academy of Pediatrics, the American College of Physicians in particular, as well as American College of Obstetrics and Gynecology have really been out there when it comes to guidelines around vaccinations and speaking. I would say many of the state governments now are also banding together to really look at how they can really prepare for protecting the health of their citizens across state borders as well. They've got regional approaches. So I would say, people are starting to reinvent, public health and prevention more locally and through organizations.
Are we more at risk for a COVID-like global virus now than we were before COVID?
I would say we are more at risk in that we won't see it coming. And then if it does come, we're not going to be prepared because we won't have the people on the ground. We won't have a coordinated response, and we likely won't have the resources. So I am very worried. That's the thing that keeps me up at night is to, when, I shouldn't say, because we know at some point
something's coming,
that we will not be prepared.
Well, Deb, I really appreciate your spending time. I know you've got a tight schedule, but listen, not every hero in America wears a uniform. And you are one of them. You have done an enormous service to the country in government, and you did an enormous service to America when you left government.
Well, thank you. I appreciate you having me on the show, and I really hope, everybody gets their flu and COVID vaccine this season and stay safe.
Thank you. Appreciate it.